Welcome to This Explainer. Today, we're going to demystify India's booming pharmaceutical sector and completely untangle the alphabet soup of pharmacy degrees. If you've ever looked at the medical field and wondered how the professionals behind the medicines actually get to where they are, well, you're in exactly the right place. We're going to look closely at the educational framework that builds these amazing careers right from the ground up. So let's dive into this by first figuring out what your end goal actually is, because navigating these paths really requires knowing your final destination. As our source material points out, a career in pharmacy is absolutely not a one-size-fits-all journey. Asking yourself this exact question right now is going to help you map out your educational path and, honestly, make sure you don't waste time on a route that just doesn't fit your ambitions. Okay, here is our roadmap for today. 1. D Pharma, the quick start. 2. B Pharma, the industry standard. 3. M Pharma, mastering the science. 4. PharmD, the clinical route. And finally, 5. Choosing your career path. Section 1. D Pharma, the quick start. Governed by the Pharmacy Act of 1948, this 2-year course is widely considered the absolute fastest, most accessible way to kickstart your career. It's really perfect for anyone who needs to start earning a paycheck early on. You just need a 10+2 in physics, chemistry, and biology, or math, to enter. And get this, you only need a minimum of about 40% passing marks in your 12th grade to be eligible. Plus, it's an annual system, not semester-based. That means you just focus on your first year, finish it, then tackle your second year. It makes the whole process incredibly straightforward. But here's the catch. Academics alone just won't cut it. To graduate, you absolutely must complete exactly 500 hours, which is roughly 3 months of hands-on hospital training. You literally can't just be a bookworm here. This practical training is where you learn how to interact with real patients in a hospital or community setting, and that's absolutely vital for the types of roles D Pharma grads usually take on. And there's a relatively new twist. To actually become a registered pharmacist now, you have to conquer the National Exit Exam. But honestly, it's surprisingly straightforward, especially since there is 0 negative marking. It's conducted by the NBEMS, that's the National Board of Examinations in Medical Sciences, the exact same folks who test medical doctors. If you enrolled after 2022, you've got to take this to get your registration. But you only need a 50% score, and it's based entirely on the theory you already studied during your 2 years. Section 2. B Pharma, the industry standard. Stepping further up the ladder, we hit the 4-year undergraduate degree known as B Pharma, or Bachelor of Pharmacy. Now, there is a massive contrast between these two entry paths. While D Pharma roots you directly in hospital settings and patient care, B Pharma? It completely pivots you toward industrial manufacturing and drug research. This is an absolutely crucial difference when comparing professional roles. A D Pharma grad is usually your go-to pharmacist in government hospitals or community medical stores. But a B Pharma grad? They're literally the backbone of the drug manufacturing industry. They focus on the nitty-gritty of how a drug is synthesized, formulated, and rigorously tested long before it ever reaches a patient. But here's where the Indian educational system gets incredibly flexible. What if you already hold a D Pharma? Well, you can use what's called a stepping stone method via lateral entry. This lets you complete your B Pharma in just 3 years, all while you can continue to work and earn money. You simply bypass the entire first year of the bachelor's program and jump straight into the second year. It's a fantastic option for folks who started small but are hungry to keep growing. Section 3. M Pharma, mastering the science. All right, so once you've got your bachelor's, it's time to talk about the postgraduate route for true academic mastery. Let's talk about the GPAT, the Graduate Pharmacy Aptitude Test. This is a total game changer. It's an exam that not only secures your spot in a top-tier 2-year M Pharma program, but it actually pays you to study. Just imagine getting into a great college and getting 12,500 rupees from the government every single month just to further your education. It completely flips the financial dynamic of higher learning upside down. In the M Pharma program, you dedicate 2 years entirely to one single specialty, like pharmacology, which perfectly sets you up for an additional 3-year PhD focused purely on research. In fact, the entire second year of your M Pharma is completely devoted to research work. This path is really for those students who want to become highly specialized experts, pioneer new drugs, or eventually go on to teach at the university level. Now that brings up a fascinating question about a highly sought-after, relatively new degree in India. It's really a question of prestige and elite clinical expertise. What prestigious 6-year course, introduced to India back in 2008, officially grants pharmacists the doctor prefix?
Section 4. PharmD, the clinical route.
The answer is PharmD, or a Doctor of Pharmacy. This is the absolute clinical elite of the pharmacy ladder, but it requires a massive 6-year commitment. We're talking 5 years of intense, heavy-duty academics, followed by 1 full year of hospital internship. Though if you already have a B.Pharma, you don't have to start from scratch. You can actually join this program directly in the 4th year, effectively turning it into a 3-year journey. However, and this is a big however, this prestige comes with a pretty hefty price tag. We're often talking between 20 to 25 lakh rupees, making it a very serious financial consideration. Because there are basically no government colleges offering this specific degree right now, you're looking exclusively at private institutions. It is a premium clinical education with a deep dive into analytical chemistry, monographs, and highly advanced patient treatment. Yes, it lets you attach that coveted doctor prefix to your name without going the traditional MBBS route, but you definitely need substantial financial backing to make it happen.
Section 5. Choosing your career path.
So, with all these options on the table, how do you actually choose your path in the real world? Let's review the average timeframes and professional roles side by side. Honestly, you might want to grab a screenshot of this because it's a great cheat sheet. Want a swift entry into patient care? D.Pharma takes just 2 years. Looking to build the manufacturing industry? B.Pharma takes 4 years. Eager to be a specialized researcher? M.Pharma is an extra 2 years after your bachelor's. And if you want to be a top-tier clinical expert with a doctor title, PharmD requires 6 years. Your personal goals and timeframe completely dictate which path you belong on. And depending on the degree you choose, your daily grind could look vastly different. You could be counseling patients in a community pharmacy or using your excellent communication skills as a medical representative in sales and marketing. If you go for the higher degrees like M.Pharma, you'll be highly sought after as an assistant professor in academic teaching or recruited by clinical research organizations to handle complex drug trials and quality assurance. There is just a massive scope out there, well beyond just opening a medical store. So the biggest takeaway here is that you're never locked into just one choice. The Indian educational framework is brilliantly designed to let you build your career step by step as your finances and interests grow. As our source material highlights, you might start working at 18 or 19 with a D.Pharma, start earning some real money, and then use lateral entry to fund your B.Pharma and eventually even your M.Pharma. You can totally evolve as your life evolves. I'm going to leave you with this final thought to ponder. Based on your unique financial reality and your specific professional ambitions, which rung of the pharmacy ladder are you going to step onto first? Take some time to analyze your goals, review the options we discussed in this explainer, and then take that confident first step into the medical field. Whether it's patient care, industry, or research, the path is perfectly laid out for you. Thanks for joining me on this deep dive, and keep learning.